Hi parents, it's Dr. Nicole Baldwin, board certified pediatrician, here today with 5 things that I want you guys to know about fever. Number 1, fever is defined as a body temperature above 100.4 degrees Fahrenheit or 38 degrees Celsius. So no matter what your child's baseline temperature is, even if it runs a little bit lower, a temperature still doesn't kind of technically exist until their temperature is 100.4 or above. Number 2, fevers aren't necessarily harmful. Fevers are our body's way of fighting off infection because things like viruses and bacteria don't like to live at high temperatures. So having a fever is sometimes a really good thing to help us fight that infection. Number 3, the height of a fever doesn't necessarily indicate the severity of an illness. So if your child has a very high fever, and some kids just do spike high fevers, but they're acting fine, drinking fine, we don't necessarily need to be called for that fever. But if your child has even a lower fever, but they're very lethargic, they're getting dehydrated, they're not able to eat or drink anything, then we do need to know about that. So again, it's not necessarily the height of fever that we worry about. Number 4, you don't always have to medicate a fever. Again, if your child is acting fine, if they're drinking, if they're comfortable, you don't need to give them medication because that fever is going to help them fight off that infection. However, if your child is very uncomfortable, if they're not drinking well because they just are not feeling great, then please go ahead and give them medication to help them feel better, either acetaminophen or ibuprofen if they're over the age of 6 months. You can also put your child in a lukewarm bath or use a cool washcloth on their forehead or the back of their neck. That can help bring that temperature down as well if they're feeling especially uncomfortable. And number 5, when should you call us with fever? So certainly if your child is under the age of 2 months and they have a fever, we need to know about that right away. Your child needs to be seen. If your child has a fever for a consecutive 5 days in a row, they also need to be seen and evaluated. And if you have a young child that's not verbal and cannot tell you if something hurts or not, it's probably a good idea if they have a fever that lasts for more than a couple days to bring them in so we can check and make sure they don't have an ear infection or anything else. And certainly if your child is having difficulty breathing, severe cough, or dehydration, they need to be seen as well. So those are some quick tips about fevers. And if you have any other questions about fever, drop them in the comments below.